Hello, everyone. This is Dr. Tahir from Youthful Medicine. Welcome back to my channel. Today, I am going to discuss with you an important case of a 91-year-old female that has been a patient of mine and has osteoporosis. This is a common condition that we see as an elderly population. Comes to us and we check for DEXA scans and find out that they have porous bones, that it increases the risk of fracture, and we're going to treat them. So we treat them with medications, which traditionally are among four groups of medications. I'm going to focus today on a case with this case where she's on a medication called Reclast, which is an intravenous infusion once a year for osteoporosis treatment. Now, this patient who is currently on Reclast recently needed a dental extraction due to dental infection in a broken tooth. So in this video, we'll explore what potential complications we have to think of when a patient who is on osteoporosis medicine is going for a dental extraction. The complication is called osteonecrosis of the jawbone. In this video, I'll talk to you a little bit about what is osteonecrosis of the jawbone and who are the people that are increased risk of this problem and how we can help manage them, as well as continue to treat their osteoporosis, the main problem they're here. So if you or your loved ones have osteoporosis and taking medications such as Reclast, this is essential information for you to make sure that you share it with them. And remember, if you find this content useful for you, please share it with your loved ones, subscribe to it, and so that I can continue to produce this type of content for you guys. So let's start about osteoporosis. As osteoporosis is a universal phenomenon, it is a painless disease of the bone um, structure. In this condition, bones become weak, they become brittle, and increases the risk of fractures. As we age, especially in women, in postmenopausal state, because of the lack of the estrogen, the bone loss accelerates. The density of their bone becomes much, much weaker. Excuse me. So for my patient, a fracture of her tooth or any other parts of the bones demonstrates the loss of bone mineral density. So you can also expect fractures of other parts of the body which are not commonly thought, like vertebral fractures, fractures of your wrist bones, your hip bones, they can easily fracture. So when a patient has osteoporosis, their jawbone is already um, delicate, and it increases the risk of further fracture or complications while they're being treated on the medication. So Reclast, one of the medicines this patient is on, it is used to give her to prevent the ongoing bone loss, but the bone physiology changes because of the medication also, and the turnover of the bone is much less. In this case, if we were to go ahead and operate on this case and pull out the tooth, the cavity that is formed in her jawbone is now at a risk of not filling up with the new bone. And this already delicate bone is at a risk of fracture. Now, you can either lead to fracture or an infection that will not heal. So, osteonecrosis of the jawbone is pretty rare. It's 1 in 100,000. It's a serious condition where the jawbone does not heal properly after minor injury, such as tooth extraction or dental procedures. In osteonecrosis of the jawbone, um, the bone tissue dies due to lack of blood supply, and it's more commonly associated on patients who are on medications such as Reclast. In other cases, you can also consider Prolia as one of the medications, so which are designed to treat osteoporosis by preventing further loss. And how I try to tell patients is there is a dead tissue in that bone that had a decay or infection, needs to come out. But our medication is preserving the longevity of the cells of the bone cells, so you won't lose that. That's why patients taking these medications need to be cautious about the dental work. While exact mechanism of this complication is not clearly understood, it is believed that bisphosphonates which is Reclast intravenous form, there's Fosamax, which is the oral form of the medicine, may impair the bone healing, particularly in areas where the rapid turnover is needed, such as our jawbone after the surgery. So, what are the risk factors for this complication? Well, in my 91-year-old patient who is on Reclast, the risk of osteonecrosis of the jawbone include medication, as I mentioned, Reclast, Prolia, these medications which are used for osteoporosis, they do increase the risk of it. And long-term use, I mean, our patients sometimes start the treatment in their mid 70s, and by the time they're have had they're in ninth decade, they've been on the medication for about 15 years. So long-term use of medication increases the risk further. These medicines do tend to stay in your bones longer periods of time. Now, advanced stage like my patient increases the risk of uh, complications of surgeries, infections, and a poor bone health to begin with. Dental procedures, any invasive dental procedure, infections of the teeth can cause this osteonecrosis of the jawbone. Other factors such as smoking, pre-existing uh, dental issues, poor oral hygiene, um, and complications such as history of chemotherapy, cancers, poorly controlled diabetes. All of these are risk factors that should be known. Now, how to lower the risk of osteonecrosis and improve osteonecrosis of the jawbone and improve bone health? Well, my practice, I tell my patients that if you are planning to go on to any of these medicines that I'm going to suggest, please make sure that you have a pre-treatment dental evaluation. I collaborate with many local dentists that take care of our patients, so they check it, make sure the patient has no existing broken tooth that needs to come out. They don't have an infection, they don't have an impending infection. Number two, we educate them on importance of regular dental care, encouraging regular dental checkups, and taking care of your dental hygiene. Brushing, flossing is really important. 2 times is minimum. You could do even 3 times, but it's really important to keep taking care of your dental hygiene. Prevention of the dental care can reduce the risk of need for extractions and lower the chances of osteonecrosis of the jawbone. And that's how prevention is the key in osteonecrosis of the jawbone. Number two, medication management. When patients are on these medications, taking a drug holiday, if possible, is really important because you can give breaks in between. I try to tell patients, if you got reclassed before you come for the medication, go see your dentist, make sure that they give you a green light that you can go for this year's treatment and I can treat it. In case of an emergency, if it happens, we have to manage for any signs of complications, and I usually work very closely and have regular follow-ups with the dentist to make sure the bone is healing. Now, if it is possible, I tell patients to delay the elective surgeries in Reclast as long as possible. So if you get a yearly treatment and you are planning a surgery, plan the surgery when you're past the 6 months to 9th month window of your last Reclast, so that you can plan the surgery closer to your next dose. And the same is with the Prolia. It is important to evaluate that this sort of treatment can be also, the risk can be also checked by a blood test, which I'll talk about at a later time. It is somewhat reliable to assess the risk of osteonecrosis of the jawbone. Uh, then healthy lifestyle, adopting a lifestyle that supports bone health is essential. Taking care of your bone health while you're being treated for osteoporosis, make sure that you are staying active, and that would improve the outcomes of your treatments as well. Avoidance of foods that actually can lead to dental problems, like sweet or hard foods that can lead to cracking your teeth, is also something that you should keep in mind. And making sure that your nutrition is adequate in amounts of diet and calcium and vitamin D. So, and smoking, which is a risk factor for osteonecrosis of the jawbone, I would suggest work with your private healthcare provider and find ways to help reduce or quit smoking. So, last importance of monitoring and early detection of osteonecrosis of the jawbone is really important. ONJ in elderly population can complicate their life. It is especially important that if you are going for a dental extraction, make sure that you have a follow-up with your dentist every month to 6 weeks follow-ups. And we do not give patients medications if they have had a surgery until we have a clearance from the dentist that they have fully healed. If you have early, so what are the signs of early signs of osteonecrosis of the jawbone? You will have a jaw pain, you will have swelling, you will have exposed bone after the dental work. So regular assessments can catch early problems. And I've had cases where we actually caught it and they were able to be treated and recovered. Um, so there are also regular scans that can be done. Your dental scans can be done to pick up any complications of the osteonecrosis of the jawbone, like the CT scan of the mandible that I usually order sometime if needed be. So in summary, osteonecrosis of the jawbone is a complication while you are being treated for osteoporosis, and the way to avoid it is to have regular dental checkups. Again, this is the wrap up today on the discussion of osteoporosis and osteonecrosis of the jawbone. If you found this information helpful, uh, be sure to like this video and share it with others and your loved ones, and subscribe to my channel, Youthful Medicine. Until next time, take care of yourselves.